Well, hey everybody, this is Robert, and welcome to Outbreak News TV. And for those that are new to the channel, I want to go ahead and just give you a little introduction. My name is Robert, of course, and I have several decades of microbiology experience, mostly in clinical. However, I do have experience in quality control microbiology and industry, veterinary, and public health. I have a master's. My highest degree is a master's in tropical public health and communicable diseases. I worked overseas where I got a lot of experience, particularly in parasitology. And parasitology, by the way, is my true love of all the areas of microbiology, bacteriology, virology, mycology, etc. I've written for a number of websites over the years, and currently for the past 2 years or so, I've been doing a Substack, outbreaknewstoday.com, and you can see it scroll across the bottom. I do a podcast, Outbreak News Interviews. I've been doing that since 2017. And from 2013 to 2019, I did a radio show here where I live weekly. It was called Outbreak News This Week. So that's kind of the little rundown of me and what I do. So these are just, I have a lot of fun doing this stuff, fun hobbies. I do work a full-time job, so this is not how I make my money. But yeah, so just an introduction for people new to the channel. Let's go ahead and get into the topic today. And before I get started, I want to remind you to subscribe to the channel, like the video, comment below. I want to hear what you have to say. Share it with your friends, like other videos on the channel, share them also. Any kind of support and growth, clearly I'll appreciate it very much. So today's topic is Africa, Ebola in the Democratic Republic of the Congo, and Marburg in Ethiopia. I want to talk about those two outbreaks kind of briefly. And I'm just picking those two because there's a plethora of things I could be talking about in Africa right now. But because these are just two of the most pathogenic viruses known, I just want to talk about these in this short video. Let's start out with the Ebola outbreak in the Democratic Republic of the Congo. And that's just a map, shows you the location. On December 1st, the Ebola outbreak was declared over. Very good news there. And there you see a bunch of officials from the DRC. And on December 1st, the Ministry of Health of the Democratic Republic of the Congo declared the end of the Ebola virus disease outbreak, which had been declared 3 months earlier on September 4th. Of course, the end of the outbreak, it was declared after 2 consecutive incubation periods, 21 plus 21, 42 days, since the last person confirmed with Ebola tested negative for the virus and was discharged on October 19th. On November 30th, a total of 64 cases, 53 that were confirmed, and 45 fatalities, so a case fatality rate of 70%, was reported from 6 different health areas in the Bulabe health zone of Kasai province. So since the last confirmed case was reported on September 25th, no new confirmed cases have been reported. There they saw 5 cases among health workers, 4 nurses and 1 laboratory technician, 3 of them died. The outbreak initially involved nosocomial transmission, hospital-associated transmission, and a high transmission funeral gathering with high mortality among young children. Next thing I want to talk about real quick is, now, as many of you have heard, this has been the 16th Ebola outbreak in the DRC. The first one was back in 1976, and you can see on this little list, 88% of the people died, and it goes down. A lot of it depends on which Ebola strain. The Zaire Ebola virus, those are the ones accountable for the 88, 81%, 71%. And then there's been a couple of outbreaks that was not the Zaire Ebola virus, but it was a less lethal one. Anyway, so those are the 15 other outbreaks other than the one we're dealing with now, or just got over. Now, the public health response, several different things was done to get this outbreak under control and finally declared over. There was a lot of coordination. There was a response team from the World Health Organization that worked with the Ministry of Health. The World Health Organization deployed over 100 experts and frontline responders to support the national authorities in the response. Surveillance activities were really scaled up a lot in the Bulape area, in other surrounding areas, and where they investigated more than 100 alerts. The laboratory capacities were strengthened. Mobile laboratories were deployed to reduce the turnaround time. The DRC Ministry of Health performed full genome sequencing on the sample of the first confirmed case, and the findings indicated that the outbreak was most likely the result of a spillover event from a zoonotic reservoir, some kind of an animal. Case management. The World Health Organization and their partners set up Ebola treatment centers in Bulape. Other capabilities were beefed up. Monoclonal antibodies were available for patients. Vaccination, nearly 50,000 people were vaccinated with the Ervebo Ebola vaccine in several of the health zones. A ring vaccination strategy was implemented. And another thing that people don't really think about when you're talking about Africa in particular is, how do we keep these vaccines good? And ultra cold chain equipment was installed in the area to support the vaccine storage and distribution. There was infection prevention and control, and a lot of risk communication and engagement with the community. Disseminated messages, promoting protective behaviors, getting involved with teachers and religious leaders and other trusted influencers in the area to help build the trust and community cooperation. And just a little rundown at Ebola. Ebola virus disease is caused, of course, by the Ebola virus. The virus is transmitted to humans through close contact with the blood or secretions of infected wildlife, and then spread through human-to-human transmission by direct contact with bodily fluids, organs, contaminated surfaces, and materials. The incubation period, or the time between infection with the virus and the onset of symptoms, is about from 2 to 21 days, but typical is somewhere in the ballpark of a week. During this incubation period, people are not infectious, but they become infectious with early symptoms. So the transmission risk begins at the onset of clinical signs, and increases with disease severity. Case fatality ratios range from about 25%, depending on the species of Ebola, to 90%. The disease itself is characterized by, of course, an acute onset of fever and a lot of nonspecific symptoms that you see in a lot of diseases: abdominal pain, fatigue, malaise, sore throat. Then after several days, more severe symptoms: vomiting and diarrhea, maybe a rash. And then very severe, the hemorrhagic manifestations, the bleeding and the shock and multi-organ failure, et cetera, et cetera. And sometimes there can become problems, with the eyes, with the testes. It's been considered sexually transmitted. And then another big issue with Ebola is, the family members and the healthcare providers and people that are involved in the burials that come into direct contact with the deceased are at pretty high risk, right? Especially these burials where the tradition is to touch the body and during their mourning. Very dangerous practice. So, that's one of the things that health officials try to get out to the public, is to abstain from that. Now, the other outbreak I wanted to talk about is the one that's currently ongoing, is the Marburg virus disease outbreak in Ethiopia. Now, this is, of course, the first Marburg virus disease outbreak that the country's ever seen, and it started around mid-November. It started out in Jinka town in South Ethiopian region, but cases have also been reported in Hawassa city in Sidama region, which is slightly northeast of Jinka town. The latest, as far as the outbreak case count and deaths, as of December 5th, Ethiopia officials have reported 13 confirmed Marburg virus disease cases and 8 fatalities. 4 of the confirmed cases have recovered and 1 is currently being treated. Vaccines. We've got some recent news about vaccines. The Ethiopia Ministry of Health reported that the United States government had provided over 2,000 doses of the investigational Marburg virus vaccine to support the response effort. The vaccine was handed over to the Ethiopian Pharmaceutical Supply Services by the U.S. ambassador to Ethiopia. Now, the vaccine is going to be used in a fast-track phase 2 clinical trial led by the Armour Hansen Research Institute, according to the Minister of Health, Dr. Mekdes Daba, adding that the Research Institute will monitor it in collaboration with the Ethiopian Food and Drug Authority. The vaccine will be distributed starting December 8th, with priority given to health workers and high-risk groups. The ambassador said that the United States has proven to be a strong partner to Ethiopia since the beginning of the Marburg outbreak. Like I was talking about with Ebola, you see the same issues with Marburg, and there's an issue with funeral practices, and the health authorities are stressing in this recent flyer to avoid traditional funeral burial practices, as contact with a deceased body or fluids poses a very high infection risk. And with several of the confirmed cases that were linked to unsupervised burials, public health guidance urges safe, respectful burial protocols and excluding direct body contact to contain the virus spread. Again, very serious, much like its cousin, the Ebola virus. And let me talk just briefly a little bit about Marburg. Marburg virus disease also can cause a severe hemorrhagic fever. It's closely related to the Ebola viruses. Marburg virus disease has a high case fatality rate, ranging from about 24% to 88%, according to previous outbreaks. I think right now it's about in the 60%-ish area. Now, the case fatality rate can be lowered with good and early patient care. The virus was initially transmitted to humans via fruit bats, and then it spreads among people through direct contact with bodily fluids, contaminated surfaces, or infected materials. Healthcare workers, caregivers, and individuals involved in burial practices are at high risk when infection prevention and control measures are not well in place. The symptoms, again, this is almost like repeating Ebola. The symptoms typically are abrupt after about a 2 to 21 day incubation period, fever, severe headache, malaise, muscle aches, gastrointestinal problems. Then with a severe case, the patients will experience bleeding from multiple sites, and they may die from shock and organ failure within a week of symptom onset. So it's nothing to play around with. Now, there's no approved treatment or vaccines for Marburg virus disease. It's all supportive treatment, and early supportive treatment and care does improve survival. And as I mentioned a little bit earlier in this, there are some candidate vaccines that are currently under investigation. And in cases like that, sometimes they get sent out to the country that's experiencing one of these type of outbreaks. And there's been 19 outbreaks of Marburg virus disease globally. Most of them, of course, have been in Africa. There's been cases reported outside of Africa also. And that's basically it. Those are the two high fatality outbreaks that were and are going on in Africa right now, in the DRC and Marburg in Ethiopia. Anyway, so that's it about these two outbreaks. I'll be clearly, if you want to learn more and you want to keep up on this stuff, because I write on the website more about it than I do videos. So I encourage you to check out the website, outbreaknewstoday.substack.com. And I appreciate you watching. Again, subscribe to the channel, like the video, share with your friends, comment below, and I'll see you next time on Outbreak News TV.